Have you ever wondered about the invisible enemies that have plagued humanity since time immemorial? These enemies, often unseen and unacknowledged, have shaped the course of our history, society, and individual lives in profound ways. They are infectious and parasitic diseases, our relentless foes in the battle for health and survival. Infectious diseases are caused by pathogenic microorganisms, such as bacteria, viruses, fungi, or parasites. They can spread directly or indirectly from one person to another, making them a common and persistent threat to public health. Parasitic diseases, on the other hand, occur when an organism invades a host and starts to multiply, often causing harm in the process. Both types of illnesses have been with us since the dawn of mankind and continue to affect millions around the globe today. Infectious and parasitic diseases have played a significant role in our history. They've decimated populations, altered political landscapes, and inspired scientific discoveries. From the plague of Athens in ancient Greece to the tuberculosis epidemic of the 19th century, these diseases have left an indelible mark on human societies. In the modern era, we've made significant strides against many infectious and parasitic diseases. We've developed vaccines, antibiotics, and other treatments that have saved countless lives. However, the battle is far from over. New diseases continue to emerge, and old ones evolve, becoming more resistant to treatments. The impact of these diseases on human health is vast. They can cause a range of symptoms from mild discomfort to severe disability or even death. They can also have long-term effects, impairing a person's quality of life for years after the initial infection. In the face of such adversity, it's crucial to understand these diseases, their origins, and how they spread. Knowledge is our most potent weapon in the fight against these invisible enemies. Now let's delve into the history of some of these diseases, starting with malaria. Malaria, a disease as old as civilization, was discovered in the 19th century. This deadly illness, born from the bite of female Anopheles mosquitoes, was first identified by French physician Charles-Louis Alphonse Laveran in 1880. He observed the parasite in the blood of a patient suffering from malaria, a groundbreaking discovery that earned him the Nobel Prize in Physiology or Medicine in 1907. Malaria's reach wasn't limited to the tropical regions where mosquitoes thrived. Over the centuries, it spread across the globe, carried by the tiny wings of its infectious agents. Today, malaria continues to be a significant health concern, especially in sub-Saharan Africa. Despite several advancements in medical science, the fight against this ancient enemy is far from over. Yet, hope persists. With ongoing research and the development of new treatments, we aim to turn the tide against malaria. From mosquitoes, we move on to a disease that once was synonymous with social ostracization: leprosy. Leprosy, the oldest disease known to mankind, was discovered in ancient times. This disease, caused by the bacterium Mycobacterium leprae, was mentioned in the earliest civilizations of China, Egypt, and India. As civilizations evolved and expanded, so did leprosy. It traveled with humans, crossing oceans and continents, leaving a trail of fear and devastation in its wake. In the Middle Ages, leprosy was a common sight in Europe, with leper houses established to isolate those affected. Fast forward to the 21st century, although leprosy is now rare, it continues to persist in some parts of the world, largely due to social stigma and lack of access to medical care. Thanks to advancements in medical science, leprosy is now curable with multi-drug therapy. But the battle against leprosy is far from over. With early detection and proper treatment, we can hope to finally eradicate this ancient scourge. Next, we turn to a silent killer that still claims lives today: tuberculosis. Tuberculosis, also known as the White Plague, was discovered in the 19th century. This formidable disease, caused by a bacterium called Mycobacterium tuberculosis, has been a constant adversary to public health since its discovery. Initially, it was a rampant killer in Europe and North America, often associated with overcrowded and unsanitary living conditions. However, with the advent of antibiotics in the mid-20th century, tuberculosis became a manageable condition, though not entirely eradicated. Today, tuberculosis remains a global concern, especially in developing countries where access to healthcare is limited. It's estimated that around a quarter of the world's population is infected with the tuberculosis bacteria, though not all will develop the disease. The spread of multi-drug resistant strains presents a new challenge in our fight against this white plague. Now, let's discuss diseases that are often shrouded in stigma. Sexually transmitted diseases. Syphilis, gonorrhea, and AIDS were discovered in different periods but share a common mode of transmission. Let's dive into the past. Syphilis, an old foe, was first documented in Europe in the 15th century. It spread rapidly across the continent, leaving no social class untouched. Fast forward to the 19th century, gonorrhea, often referred to as the clap, was identified. This disease, like syphilis, quickly became a global concern. Now, let's take a leap into the more recent past. The 20th century brought us face to face with a new and devastating enemy, AIDS. First recognized in the early 80s, AIDS, caused by the HIV virus, became a global pandemic in less than a decade. Each of these diseases, discovered in different eras, share a common thread. They are sexually transmitted infections. Passed from one person to another through sexual contact, these diseases have spread across the globe, affecting millions of lives. Today, we find ourselves in a world where these diseases are still prevalent. Syphilis, once a major cause of public health concern, is now easily treatable with antibiotics. However, it continues to affect a significant number of people worldwide. Gonorrhea, too, can be managed with the right treatment, but the rise of antibiotic-resistant strains is a growing concern. And then we have AIDS. Despite the giant leaps made in medical science, a cure for AIDS remains elusive. Antiretroviral therapy has been a game-changer, allowing those living with the virus to lead healthier lives. But the disease continues to claim lives, reminding us that our battle is far from over. These diseases, though often unseen, are very much a part of our present reality. They remind us of the importance of education, prevention, and the need for continued research. Infections and parasitic diseases have been part of our past and present. But what about the future? The future holds promise for the prevention and cure of these diseases. Our ability to combat infection and parasitic diseases lies within the realm of research, awareness, and healthcare measures. These three pillars act as our shield and sword in the ongoing battle against diseases like malaria, leprosy, tuberculosis, and sexually transmitted diseases such as syphilis, gonorrhea, and AIDS. Scientific research, the cornerstone of medical advancement, has been ceaselessly pushing the boundaries of our understanding. The development of newer, more effective treatments and vaccines is a testament to this. For instance, the RTS-AS01, RTSS, is the first malaria vaccine shown to provide partial protection against malaria in young children. Similarly, the advent of highly active antiretroviral therapy, HAART, has transformed AIDS from an almost certainly fatal condition into a manageable chronic disease. However, these advancements are only as effective as our ability to implement them. This is where awareness comes into play. It's crucial to educate individuals about the signs, symptoms, and transmission methods of these diseases. This knowledge can prompt early detection and treatment, reducing the risk of complications and further spread. Healthcare measures, the third pillar, encompass a broad spectrum of strategies. These include effective disease surveillance, strengthening healthcare systems, ensuring the availability of medicines, and implementing preventive measures like vaccination programs. For instance, the directly observed treatment short course DOTS strategy for tuberculosis has been successful in many countries, leading to a decline in disease prevalence. Moreover, the integration of technology in healthcare, such as telemedicine and digital health platforms, has made health services more accessible, especially for those in remote areas. But the fight is far from over. Many challenges remain, including drug-resistant strains of diseases and unequal access to healthcare. Nevertheless, the continuous pursuit of knowledge and innovation gives us hope. In the face of adversity, the human spirit has shown time and again its resilience and capacity for hope. And it is this hope that propels us forward, as we continue our quest for a world free from these diseases. Remember, knowledge is the first step towards prevention. We have journeyed through time, exploring the invisible enemies of mankind. We have delved into the world of infections and parasitic diseases, seeking to understand their origins, their impacts, and their insidious ways. We've seen how the humble mosquito can be a deadly foe, carrying the scourge of malaria. We've walked the path of history, tracing the ancient bane of leprosy, the white plague of tuberculosis, and the unseen pandemic of sexually transmitted diseases. We've explored the prevention strategies, the cures that have been discovered, and the hope that ongoing research brings. These invisible enemies may be formidable, but knowledge is our most powerful weapon. By understanding these diseases, we can equip ourselves to face them and perhaps make a difference in this ongoing battle. Subscribe for more because you won't find me later. Together, let's unveil the mysteries of the medical world.